Greetings of the day, folks. Today we are going to discuss about hepatic encephalopathy, clinical features and classification. So, hepatic encephalopathy it may present as a spectrum of reversible neurocognitive symptoms and signs, which may range from mild to profound mild changes in the cognition to profound coma, mainly seen in patients with acute or chronic liver disease. It is often precipitated by an inciting event such as GI bleeding, electrolyte abnormalities, and infections, medications, or dehydration. The diagnosis requires consideration carefully in the appropriate clinical situation. It may be occasionally requiring, like the patient might be having an initial presentation of CLD, but we must be carefully considering in those terms. The subtle findings in overt HE include forgetfulness, alterations in the handwriting, difficulty with the practical skills like driving, and also the diurnal cycle, that is sleep-wake cycle, will be altered. And as HE worsens, these findings may exacerbate. So, patient might have a exciting neuromuscular symptoms such as asterixis and cognitive syndrome like agitation, disinhibited behavior, seizures, and coma. So the other causes of altered sensorium must be ruled out in order to diagnose a patient with hepatic encephalopathy. So patient might be having some hypoglycemia, hyponatremia, medication ingestion, or any structural intracranial abnormalities, which might be resulting from coagulopathy or trauma, which must be ruled out. Okay, in order to conclude. So there are majorly three types of HE. Type A, which is associated with acute liver failure, A for A. B for portosystemic shunts. It is associated with the portosystemic shunt in the absence of liver disease, such as uh, Budd-Chiari syndrome or any other disease where there is a presence of portosystemic shunts due to some pathology, vascular pathology. Okay, so then coming to the type C, C for chronic. Okay, so it is associated with the chronic and end-stage liver disease and portal hypertension. We see type C is the most common cause, and it has been historically graded from 0 to 4 on the West Haven table. And there is also another consensus report in 2011 which has proposed SONIC, that is spectrum of neurocognitive impairment in cirrhosis. Spectrum of neurocognitive impairment in cirrhosis. Nomenclature to reflect the wide spectrum of the clinical findings and improve clinical classification of HE for the research studies. Okay, so let's do the classification part now. We are going to see a table now, then we will look into the nuances of each one. So, okay, so let's dive in. So, in this table, you can see this is clinical stages. Now here we have a grades that is from 0, minimal 1 to 3, 4, and on the right side we are having SONIC, spectrum of neurocognitive impairment and cirrhosis. It has got only three things: unimpaired, covert, and overt. You can see here from second grade in the West Haven criteria, the sonic comparison will be having a overt HE. Okay, so there are no subdivisions in the overt HE2, so it is very broadly defined terms. Okay. So in West Haven, you can see in grade 0, everything is normal. The things which have been divided in West Havens based on which the classification has been done is intellectual function and neuromuscular function. In grade 0, you'll find normal intellectual and neuromuscular function. When there is a minimal grade of HE, then patient might be having normal intellectual function and they might be having subtle changes in the work or driving. And in neuromuscular function, there will be some minor abnormalities of visual perception or on psychometric or on number of cells. When grade 1 personality changes, there may attention deficits, irritability, and depressed state. And in neuromuscular tremors or an incoordination may be seen. Okay, so in this intellectual in grade 2, there will be changes in the sleep-wake cycle, the lethargy and mood and behavioral changes, cognitive dysfunction might be seen. In neuromuscular function, there might be asterexis, ataxia, gait, and also ataxic gait, and also speech abnormalities that might be having a slow or slurred speech. And in grade 3, you can see there is altered there is gradually dip in the sensorium, which might be presented with altered level of consciousness. Patient might be somnolent, confused, disoriented, and amnesia will be seen. And in neuromuscular block, there will be muscular rigidity, nystagmus, clonus, Babinski sign, and hyporeflexia. And in grade 4, stupor and coma will be seen. It is the highest grade in the Westhaven criteria. And you can see the aculocephalic reflex, and the patient might be unresponsive to noxious stimuli. So in Sonic, there will be classification is based on like impaired, unimpaired, covert and overt mental status, special status, and asterisk has been given a special status here, which is only seen in overt. That is from grade 2 onwards we see, and in covert, the mental status is not impaired, but the special tests like neuropsychometric tests might be impaired, and asterisks will be absent. Unimpaired, as we know, it will be normal as usual. Thank you very much. This concludes our video.